Hey everyone, today we're diving into something so many moms worry about, your baby's position. If you're anxious that your baby isn't in the best spot and it might make labor longer, harder, or even lead to a C-section, trust me, I get it. That worry is super common.
Yeah, we hear this concern a lot. What if my baby's in a bad position and it makes everything more difficult?
The truth is, baby's position can make a big difference in how smooth or tough your labor goes. But don't stress, we're going to break it down what you can do to help your baby get into the best possible position for birth. And before we jump in, if you're planning for an unmedicated hospital birth and want to feel confident and prepared, we've got a free class just for you. 4 secrets to unmedicated hospital birth. You can find the link in the description below. Trust me, it's packed with helpful tips you don't want to miss. So here's the deal. Baby's position is one of those things that can make labor go a little easier or a little harder, depending on where they're hanging out. Ideally, we want them to be in the anterior position, which means head down and their back facing your belly. That's the golden spot for most smooth deliveries. But sometimes babies get comfy in a posterior position, where their back is against your back, or even sideways, which we call transverse. These positions can make labor feel longer, more intense, or even lead to more interventions like a C-section. And then of course, there's breech, when baby's head is up instead of down. Depending on your provider, this might mean a scheduled C-section.
But there's no need to panic. There's plenty you can do to help encourage baby into a better position before labor starts.
One of the best resources out there is Spinning Babies. They have tons of techniques to help your baby rotate into the right position. It's all about helping your body release tension, find alignment, and create space for your baby to find the best position naturally.
And don't forget the Miles circuit, another great set of exercises that can help guide baby into position. And both of these techniques are awesome because they're safe for most women, they're simple, and they're easy to do at home. But of course, check with your doctor before doing any of those techniques.
On top of the Miles circuit, staying active during pregnancy is key. Walking, doing forward-leaning inversions, and prenatal yoga are all great ways to keep baby moving into the right spot. And here's a big one, posture matters. Try to sit with your body aligned, especially in the later weeks of pregnancy, and avoid slouching on the couch too much.
Another tip is seeing a chiropractor who's certified in the Webster Technique. They can help release tissues and get your pelvis more aligned, which can make it easier for baby to find the right position.
Yes, the Webster Technique can be super helpful if baby's having trouble turning on their own. And remember, it's not too early to start thinking about positioning. Around 32 to 34 weeks is the sweet spot to start using these exercises, but if you're closer to your due date, don't worry, it's never too late to try. You can even use some of these during early labor to help baby rotate. If your baby is breech, meaning their head is up instead of down, there's another option to consider, and that's an external cephalic version, or ECV. It's a procedure where your healthcare provider tries to manually turn your baby from the outside of your belly.
Yeah, ECV is often done around 37 weeks if your baby hasn't flipped on their own by then. And it's a safe option for most people and can help you avoid a scheduled C-section if baby successfully turns head down.
Exactly. The procedure involves your provider using their hands to gently guide your baby into a head down position. It's usually done in a hospital setting, just in case anything unexpected happens. ECVs can be a bit uncomfortable, but many moms find it worth trying before considering a C-section.
And don't worry, your provider will monitor your baby's heart rate throughout the whole process to make sure everything is going smoothly.
Some babies respond well to this and others may not turn, but it's a great option to discuss with your provider if your baby is breech and you want to explore every possibility to avoid a C-section. Now, can baby's position change during labor? Absolutely. Some babies don't settle into their final position until contractions begin. That's why it's so important to keep moving during labor. Walking, swaying, and changing positions can all help baby rotate as labor progresses. Your birth team can also play a huge role in helping baby get into the right spot. Your OB, midwife, or doula might suggest different positions like the side-lying release or flying cowgirl, or use a tool like a rebozo to help gently shift baby. Staying active and working with your birth team can really make a difference. And most importantly, stay calm and confident. Even if baby isn't in the perfect position right away, it doesn't mean that you're for sure in for a rough labor. Some babies turn at the last minute, and your body knows what to do. Trust yourself, stay flexible, and know you've got this. So to recap, baby's position is important, but there's a lot you can do to help them get into that ideal spot. From the Miles circuit to staying active, you have plenty of options to encourage baby into the best position for birth.
And don't forget, if you're planning an unmedicated hospital birth, we have a free class that can really help. 4 secrets to unmedicated hospital birth. The link is in the description and is packed with tips to help you and your partner feel more prepared and confident for your birth.
Thanks for watching, and if you found this helpful, be sure to subscribe, give us a thumbs up, and let us know in the comments if you have any questions or want us to cover more topics like this.
See you next time.